While the knee may appear simple, it is in fact very complex. It manages mechanical forces that far exceed body weight. The osseous anatomy of the knee is comprised of the distal femur, the proximal tibia, and a large sesamoid bone, the patella. Though the fibular head does not participate in articulation of the knee, it's an important structure when discussing ligamentous and musculotendinous attachments. The shaft of the femur widens distally, forming the medial and lateral condyles. The trochlear groove, located between the medial and lateral condyles on the anterior aspect, is the articular surface for the patella. As we transition posteriorly to a non-articular region, the trochlear groove is also referred to as the intercondylar notch or intercondylar fossa. The medial and lateral condyles are the knuckle-like surfaces of the distal femur. They articulate with the tibial plateau. Like the distal femur, the tibial plateau is covered in articular cartilage. The medial side is concave to accommodate the medial femoral condyle. The lateral side of the tibial plateau is flatter, almost to the point of a slight convexity. In the middle of the tibial plateau are the intercondylar eminences, a pair of bony ridges sometimes referred to as the intercondylar tubercles or intercondylar spines. These run anterior to posterior on both the medial and lateral sides. The anterior cruciate ligament, or ACL, is a ligamentous structure comprised of parallel fibers of collagen and fibroblasts. Though the ACL is an intra-articular structure, it is wrapped in a fold of synovium and considered extrasynovial. The ACL is subdivided into two separate bundles, the anteromedial and the posterolateral. These bundles are named for the locations their attachments insert on the tibia. The anteromedial bundle attaches on the medial wall of the lateral femoral condyle. The posterolateral bundle is just distal and posterior. When the knee is in full extension, the AM and PL bundles both align vertically. As the knee is brought into flexion, however, the bundles cross over one another into a more horizontal position. This is due to the orientation of the femoral attachments. To find the location on the femur of both bundles, measure the widest distance from proximal to distal on the medial wall of the lateral femoral condyle. Note that the point shown here is 43% of the distance from the proximal chondral margin to the distal chondral margin. The center of the AM bundle is roughly 29.5% of the distance from the proximal chondral margin, while the center of the PL bundle is roughly 50% of the distance from the proximal chondral margin. In the anterior to posterior plane, the radius of the bundles falls 2.5 mm anterior to the posterior chondral margin. Other studies identify the center of the two bundles through their proximity to the lateral intercondylar ridge, also referred to as the residence ridge. The bifurcate ridge also bisects the center of the bundles perpendicularly. This ridge indicates the center of the ACL footprint on the femur. However, identification through a landmark method can be challenging when using arthroscopy. The ACL's length ranges from 22 mm to 41 mm. Its width ranges from 7 mm to 12 mm. The centers of the ACL bundles attach distally on the tibia, just posterior to the attachment of the anterior horn of the lateral meniscus, within the intercondylar fossa and in a sagittal plane that is nearly midline on the tibial plateau. The anterior medial bundle has a larger footprint and is more ovoid in shape than the smaller and more circular posterior lateral bundle attachment it lies posterior to. The ACL is a vascularized structure. Its arterial supply arises proximally from the femoral artery as it turns posteriorly just above the level of the epicondyles. This splits into the descending genicular and popliteal arteries, which supply most of the blood in the knee and lower leg. The descending geniculate artery has articular and saphenous branches and is connected to the supraremedial geniculate artery. Innervation occurs from the posterior articular nerve, which branches off the tibial nerve. Histologic studies show evidence of Golgi body receptors in ACL tissue at the ligament's insertion.